Hi everyone, I don't know if you hear me. We're just gonna wait a minute to welcome everybody and we'll start very soon. So just to introduce the subject and everyone, hi everyone, thank you for joining us. So we're really happy, I'm Elisa from the French Water Partnership. We're really happy to organize this webinar with our partners from the French Water Partnership. The objective of that webinar is we wanted to share our experience responding to COVID in French informal settlements. So with us, we have Marion Libertucci, who is in charge of the expertise and advocacy at UNICEF-France. We have Julien Erard, the WASH advisor at Action contre la Faim France. We have Lisa, head of the French mission at Première Urgence Internationale. Rémi Boutin, who is a project officer at Aquassistance. Fiona Garnier, project officer at Eau du Grand Lyon. And Sandra Métayer, who is coordinator of the coalition of French NGO working on water. So we will start now with Marion, who will be introducing the subject, and then our speakers will follow, sharing their experience of our response since March 2020. To you, Marion.
Hello, everyone, and first thanks to the French Water Partnership for giving us the occasion to share with international stakeholders our experience and lessons learned on mobilization of the actors in France on access to WASH for persons living in informal settlements, as just Elisa said. Just to give a brief introduction, when you speak about person living in slums, in squat in France and in mainland France, because we need to focus on that. That's where we have the most accurate figures. We speak about around 20,000 persons, and it is estimated that it includes around 40% of children. That's why also UNICEF is so involved into that questions. Before the COVID crisis, of course, several actors were working in those informal settlements and with people living in those informal settlements, but ensuring their access to their rights, but not so much focusing on access to WASH. The focus was more on access to habitat, of course, to education for actors like us, or to health, but WASH was not so much addressed actually because of a lack of coordination of actors, and also because there was not a real political mobilization and understanding of the topic, because of the lack of data and the lack of coordination, as I said. And with the announcement of the lockdown that occurred in France just 1 year ago, we also, all the actors, local actors, international actors, and institutional actors, that the issue was becoming crucial. What happened is that actors working on the field, actors working with those people living in informal settlements, warned a lot of national actors about the situation in those informal settlements and about the urgency and critical aspect of the situation, because those persons were really in complete lack of access to water and sanitation because of the lockdown and information. There was no sharing of information with those population on the health situation, and of course also on the protective measures, and with of course a very high problem of access to hygiene in some of those settlements, reinforced by the lockdown. Talking with the different actors, we were working on access to education for those children on the field, working also with the national actors, especially the interministerial delegation to access to habitat. We decided to work together with ACF and Action contre la Faim to support one of their projects that was really focusing on actions and activities on those settlements, and it will be shared by our partners later on, and specifically on the issue of how to coordinate the actions. And really, that was a incredible mobilization on all the actors, because before everyone was really working on some aspect of that, or at the national, local level, but there was no exchanges, no data collections. And then it's really generated a strong will to work together. Of course, to be sure that the most vulnerable were targeted, that we were not missing any settlement, and that the needs were really covered. And really the idea was to keep this momentum of a very strong coordination. That's why at UNICEF-France, we also decided to go on working with Action contre la Faim and Solidarité International to work on a capitalization work to ensure that this collective experience allowed to build knowledge for all actors in France, especially, of course, to prepare for next crisis, because we need to get prepared. And now we have learned a lot about the needs and the solutions, but also to develop a common language on the right to access to water, hygiene and sanitation for everyone in France. So I'm very happy to be here to discuss that with everyone. And I will let the floor to Julien Héra from ACF.
Thank you. So yeah, because we are humanitarian organizations, we are used to work in different areas in the world, but maybe not really in France. So at least for ACF, it was the first time that we really start to have a project just outside of the office in Paris. And as Marion said before, one important challenge that we have to face was the coordination of the action. Because we are humanitarian agencies, we are used to work in coordination with the WASH cluster, the famous WASH cluster, and of course, UNICEF and the other agencies. So what we did in that case, three things mostly. First, we use the same tools that we are used to work with when we are in the field. The first one is a mapping, a proper map. So as you can see here on the Paris and around Paris, so we have different settlements, informal camps or refugee settlements. So the first thing, of course, now it's quite easy with the modern technology. You have a mobile phone, you have a GPS, so you can easily spot the camps or the locations on the map. Whether you share this information with authority is also, of course, important question, because some information may be confidential. So we have a map, we know where the people are. The next step is to organize among the different agencies. For this, we use the 4W matrix, which allow us to know who, where, when, and what we are going to do in this different location. So it's like Excel file, Excel table with the name of the agency, the location of the camp where the agency will work from this date to this date, and to do what? To distribute a hygiene kit, to install a water point, etc. So with this table and with constant and updating and exchange of information, we are able to have a proper mapping of the activities of the different actors, which of course is very, very important. It helps us to avoid areas without any coverage, and it also helps us to avoid overlapping of agencies in one area. The other point that is important is to work on joint protocols and joint standards. As you know, standards are very important in humanitarian help. What we want to avoid is to have one camp where people, for example, receive maybe cash, money, and the next camp, people will receive hygiene kits. So they will not receive the same aid. So for us, it's important that we are able to organize together to define minimum standards of our intervention. If you are already aware of the humanitarian sector, you know that the most common standard is the famous sphere standard. And of course, the WASH cluster and the other organization have the capacity and the latitude to change, to increase or decrease this fair standard based on the reality of the field where we work. In that case, we decided altogether to change a little bit the standard. Like, for example, here you have for the water access. For water access, the sphere standard is 15 liters per person per day. We have increased it to 50 liters. The number of people is 250 per tap. We reduce it to 50 people, etc., etc. So this is here. This is really to help us to work together with a common standard methodology, and of course to adapt it to the reality of the field, because of course reality in Paris is different from where we are used to work in Africa or Asia. And of course, as Marion said, all these standard and approaches will be explained in the handbook that will be released today. Now I leave the floor to Candice from Première Urgence International. Thank you. Over to you.
Thanks a lot. Hello, everybody. I would like to talk about the technical diagnosis that were made by the different actors that were involved in the management of the crisis. First of all, as my colleague said, there was a big census of the sites. It was the coordination on that matter was very useful. And an amazing job was done. Different actors were very cooperative. The second step was sharing responsibilities. Basically, we had to identify all the actors that were in capacity to provide technical support and expertise, which was not easy. As it was already said, there was no experience working in WASH in France, so it was really new. And we had to identify actors and also to define realistic geographic coverage for each actor. So there is also another challenge that was really important during this technical diagnosis, the challenge of acceptance by a very deprived and exhausted population. Because basically we were able to go in the sites to make assessments, WASH assessments, but it was really important that this diagnosis leads to concrete impact for our credibility. So the work was done very thoroughly by all actors mobilized. As you can see on the PowerPoint, we had to map the location of the site, to identify the water access points and how to supply these sites. We had to also identify vulnerable populations living in the sites, to identify also to be able to prioritize the assistance we would provide. And we had to coordinate with the health authorities, either at regional level or at the municipality level. So also we had to keep in mind that we had to really focus on the needs expressed by the population, because I mean what the experts could identify and observe inside was sometimes not considered as a big issue by the local populations, but they would consider other facts as of a priority. So we really had to find a balance between the technical aspects and the way of living and the wellness of the population in the site. So basically, how this diagnosis led to assistance. The first example would be the distribution of hygiene kits. If it's possible to skip to the next slide, thank you. The distribution of hygiene kits was something very important. First, because it was important to prevent the contamination, the transmission of the virus. But on the other hand, there has been with the social and economic crisis, limitations of movements for this population. It was really necessary to support their livelihood. So providing them with basic domestic items like diapers when baby kits were distributed, or kits for children with basic hygiene items, or kits for adults with buckets, broomsticks, and dishwashing and cleansing products, detergents, etc. It was very important for them not to have to buy these items, so that they preserve their revenues for food, which is the first expense in the different households we've visited. So the content of the kits was adjusted during the two, according to the needs, during the 2 rounds of distribution. The first one being from April to July, and the second one between October, and December. So basically, we had like items that could be reused and that were distributed once, like for instance, jerry cans, basins, plastic bags for trash management, but other items which are consumables were distributed regularly. Most of the NGOs involved in kits distributions took the decision to distribute kits for covering a period of 2 months, which was enough to see how the situation, the sanitary crisis, would evolve, and to decide if a second round of distribution was necessary or not. A last point from my side would be also the importance of awareness raising. We realized that people not only had very limited access to information on the situation of the crisis and on the governmental measures that were implemented, because they don't have access to television and they don't speak French, basically. It was very important for us to explain what is COVID-19 and what are the ways of transmission. It was very important to repeat the shielding measures that were to be implemented, to explain what to do when you develop signs of disease, and it was also very important as part of the management of cases to be able to refer people to the closest medical centers with the treatment capacities, and also tests that were located, that were disseminated through the different areas that we covered. That's it from my side. Thank you very much, and I leave the floor to the next person.
Thank you, Candice. So hello everyone. We'll share with you our experience of how the actions took place. So this emergency response, which consists in creating a temporary drinking water connection in the settlements, was special because of the French context. So first, the management, the local authorities and their operator, when it exists, are responsible for the water service in France. So we are not supposed to do whatever we want with the water network. All the actors have to discuss together, and the connection point must be prepared and equipped by the operator. Then we can go. So it was an important first point. And the second one is that it takes place in an urban environment where the water network is big and dense. So it's not limited neither in quantity, good pressure, good flow, nor in quality. Fine level of chlorine and all the parameters are already checked. So this is not the issue. This is why we gave technical support to our NGO partners all along their mission, in remote or by joining them on the field, especially by organizing a training session to explain the specific context. So to sum up, the main challenge is to bring drinking water from an existing point to the settlement while respecting the standards that Julian just presented. So the first step is to make the technical assessment, as Candice said. The second step is to create the best scenario we can with the data we collected. The third step is exchanges between the NGO and the local authority about the solution, and only if the plan is validated, the final step is to implement the water installation. So Elisa, you can go on. Thank you. So about this final step, you can see here some pictures of different installation and elements. And the main constraint is that the pipes are in the air, so on the surface, not buried, which increases the risk of safety, of damage, of water freezing during the winter, for example. But it also raises other issues, like is it a public or private parcel? Can we avoid crossing a road? And if not, how we protect the pipe? What pipe size we may choose for the connection, etc., etc. For example, sometimes we even use the modeling to confirm the scenario. So yes, just to show finally that it can be a very easy operation, or in some case, the implementation was a little bit more complex, technically, or even related to the decision making. So this is all for me, and I can let Fiona speak now.
Yes, thank you, Rémi, and hello everyone. I will quickly present an example of a multi-actor sanitation project in the slum of the city of Lyon. At the start of the COVID period, the Red Cross carried out food distributions in the squats and the slums in the Lyon metropolitan area. It is thanks to this distribution that the needs were raised. The project cycle involved 4 stakeholders. First, the Red Cross is requesting wash assessments and diagnosis. The Veolia Fondation carries out assessments and diagnostics on the basis of the sphere recommendation. The Red Cross alerts the city of Lyon to the slum, and then Eau du Grand Lyon for Veolia carried out the technical study in the field. The city of Lyon is financing the project in one slum with a budget of 20,000 euros. This concerns 150 people, including 40 children. This allowed the installation of 2 showers and 4 toilets. As you can see on the picture, 2 toilets for men and 2 for women. These are latrines connected to the drainage network. Other organizations have tested the tank latrine solution, so not connected, with a collection of fecal sludge for off-site treatment by a private company. In that case, the installations are connected to the drinking water network and to the sanitation network. The management and maintenance of the facilities is done by the slum, and the support and the awareness are provided by the Red Cross. If the slum is dismantled, the Red Cross becomes the owner of the sanitary facilities. So this multi-actor project involving the Red Cross, the Veolia Foundation, Eau du Grand Lyon, and the city of Lyon was a real success, with the satisfaction of recipients and elected officials. The good coordination of local actors allowed a rapid and efficient response. So thank you. I will now leave the floor to Coalition O.
Thank you. Hello, everyone. My name is Sandra Métayer. I'm the coordinator of Coalition O, the Water Coalition, which is the network of French NGOs from the water and sanitation sector. And we have been involved collectively for several years on advocacy activities around the implementation of the human rights to water and sanitation in France. Because challenges remain important in France mainland, with 300,000 people, that are not connected to the water supply network. So homeless people, people living in camps, squats, slums, etc. And also with 1.2 million people that are connected to the network, but for whom water is not affordable. So at the beginning of this year, we have a very good advocacy opportunity for legislative evolutions in France with the revised European directive on drinking water. So this new directive was adopted by the European Parliament in December, and member states now have 2 years to transpose it into their national legislation. In this revised directive, there is an article number 16, that plans that states take the necessary measures to improve access to drinking water for all, and in particular for vulnerable and marginalized groups. So with this article, the member states commit themselves to identify people without access to water and the reasons for this lack of access. They commit to assess the possibilities of improving the access and share this information, and to take measures to improve access for those who lack it. And there are also a commitment around installing facilities in public spaces. So NGOs have developed recommendations for the transposition of this Article 16. So next slide, please. These recommendations are drawn from our previous work on the human rights, water and sanitation in France, and are based on the recent field experiences of NGOs during the COVID crisis, and from the capitalization document that is being published today. So our first recommendation is about the identification of the most vulnerable population. So we need assessment in localities to identify these people without water and toilets, know the location of public water points and toilets, and then assess the needs and install and maintain public infrastructure. And this information needs to be accessible. In terms of the effective implementation of the right to water for people that lack access, our first recommendation is really to clarify the administrative organization and who does what in terms of providing access for people that are not connected to the public service, between the state, the prefecture, the local authorities, the intermunicipal cooperation establishment, the operators, the people themselves, etc., the associations, etc. Then we need to install and maintain free drinking water supply facilities in public spaces, as well as the sanitation facilities. And we need to connect people in informal settlements to the public network or install drinking water sanitation and sanitation facilities in these settlements. We also have a recommendation on social water pricing. So we need an evolution of the current legislation so that the social pricing or the solidarity pricing policies are open to people living in informal settlements, so that the price is affordable and fair. And finally, we have recommendation about the definition of a minimum standard of access in France. So next slide, please. Because right now there are no basic standards in France to define what really constitutes sufficient access to water supply for the basic needs. So based on our experiences and what was presented before, we suggest that for informal settlements, the minimum quantity of drinking water needed to meet the basic needs is approximately 40 liters per day per person, with a maximum of 50 people per water tap and a maximum distance of 200 meters. We also recommend having a minimum number of toilets, so one toilet on site for up to 50 people. And we also have recommendation on the availability of public facilities. So we would like the states and the local authorities to define a minimum number of free public water points and of sanitation facilities, depending on the size of the administrative area and the number of potential users of these facilities. So as you can see, we have recommendations on water and sanitation, even though sanitation is not strictly integrated in the European directive. The issue of access to toilets for the most vulnerable remain a very important challenge that cannot be ignored. That's why we have recommendation on the human right to water, but also on the human right to sanitation. So our recommendation and the capitalization document can be downloaded online. So I put some links on the PowerPoint presentation. And they are currently being spread by our organization to support our advocacy recommendation. So especially toward the ministries in charge of the transposition of the EU directive in France. Thank you.
Thank you everyone for your presentations. So I welcome everyone to ask your question in the chat if you'd like to ask some questions. But also, I think for all of us, we would be very interested if you're from a EU country or working in a EU country, if you're working on this transposition of the EU directive and if you're doing advocacy work, or also if you've done response in, we've heard a lot about the response in the countries where organizations usually work. But we haven't heard so much about what other countries in the EU have done to improve the access to water and sanitation in informal settlements in Europe as well. So we would really like to hear about other experience in the chat if you have any. But I'm going to take the first question that was asked by Caroline Delaire, who was asking were these informal settlements new or did they exist before COVID? I don't know if anyone wants to answer. Julien or Candice, maybe?
I can start, maybe. So that's a very good question. These informal settlements for the region of Paris, so Île-de-France, 40% of informal settlements have less than 1 year of existence because they are regularly settled and then dismantled. But the number of people living in informal settlements in France is relatively stable, around 17,000 people. And the number of sites is decreasing sometimes and increasing in other cases according to the number of evacuation. But basically, in the area of Île-de-France, there is approximately 150 informal settlements. These sites are recent, but the population has been living in informal settlements for a long time, and they regularly live and settle in other places.
Thanks a lot, Candice. I don't know if this answered the question, Julien, if you have to add anything, but it seemed very complete. We had a question also from, not from the chat, but a question about if the response is still continuing today of the association, if it was just during the confinement or if some of the organizations have continued their actions still today. I don't know if maybe Rémi, you want to respond? I know they're still engaged to support.
Yes, with Solidarité Internationale, we continue the actions, especially in some metropolis in France. So I think it's in Toulouse, in Nantes. I think it's in Lille. Yes. So we continue the intervention and the exchanges between the public or local government are going on.
And I don't know if Sandra wants to also add more maybe, but I know that a lot of the organizations have stopped their wash missions because it was really in terms of an emergency response. And the idea was to also transform the operation on the ground to more advocacy, so that local governments who are responsible for providing water and sanitation on their to their citizens, and but also to informal settlements, would take ownership more, and so that the operation would go more from doing on the ground to working with municipalities and local governments in terms of working with them for them to provide that access. If Sandra, you don't want to add anything, there's another question about gender.
Maybe I would just like to
question about, yeah, sure.
Just to say that, as you said, the wash intervention was justified by the emergency. Now we are more in a post-emergency context, but it doesn't mean that there is not a real wash stake with this population in informal settlements. But rather than addressing this stake through technical wash positioning, it's important to link this wash positioning to housing problematics, and to frame our wash advocacy, for instance, to the national policy. Currently in France, since 2018, there is an official document from the government that drafted a roadmap to avoid, to end up with informal settlements in France. So basically, so far, it has not proven efficient, but we are very hopeful that pursuing our efforts will lead to some result all in all. But this is why it's not just a wash problematics, it's also a housing problematic.
Absolutely. For that case, about the gender question, did we take in the response the gender approach? I know I have some response to that, but I'll let you guys respond if you have, and I can complete as well. Maybe Julien, I saw you saying yes. No, I can start if you want. And I know that in terms of gender, it was a little bit complicated because I say we, but because I've talked with all those guys a lot since the response, but when they started to respond, we had very little knowledge about practices in informal settlement in terms of water and sanitation, because very few assessments in humanitarian, we talk about CAP. They're like knowledge and practices survey that we conduct in order to understand better how to target also sensitization, but also how to develop infrastructure and develop kits that are adapted to the different populations. The problem with that response is that we were targeting very different communities with very different practices. So it was very different than a normal assessment. It was new, this wash response. We worked a lot with NGOs that were there for a very long time. So PUI had a long response in health in informal settlement, but we also had like Médecins du Monde who'd been there for a very long time. So we've worked with them a lot to try to address vulnerabilities, but also gender issues. So I know for WASH, what was interesting was to look at what was in the kit, hygiene kit, to be adapted to women, but also to children. So they were divided. There was kits for women, kits for men. In terms of access to toilets, it was a big question to ask if we wanted to have sanitations that were divided between men and women, or if we wanted to develop sanitation access that were for a family or for a gathering of families that knew each other, which seemed sometimes to be a better choice than a gender toilet separations. So there was a lot of questions like that that were asked and raised, and that we progressively try to address. And all of these learning, as Marion said, were the lesson learned of the gender approach or the communities approach were tried to be improved, and that we shared the knowledge from the CAP that Solidarité Internationale and Action contre la Faim had done the survey, and to improve that part. And all of that is in the document capitalisation, we call it in French. But yeah, so there was definitely a gender approach to things, and it was refined through times, but also from like past experience in other fields. I don't know if anyone want to complete that answer.
Maybe just to say that in the kits that were distributed, all kits contain sanitary towels for females. Either it's a male who received them, because we know that in the community they would exchange the content of the boxes. But this was important to have sanitary towels.
Yeah, Elisa, for our experience, it's the main issue for the gender approach is the sanitation. But at the end, the reality showed that this is maybe it's not the main question. We tried to make a family or multi-family approach. It was maybe more adapted to the context.
Absolutely, yes. Is there any other question? I know that Mr. Hamed Hussein wanted to ask a question in French. Feel free to write it in French in the chat box. We can definitely translate. So obviously, if you have questions, feel free to send me an email, or any of us. I can also transfer your questions to the panelists and the speakers. You can also consult the documents that were discussed in the presentation. There is the position paper from Coalition and from the organizations that are accessible. I think you will find the link in the chat directly. And you will also have the capitalization document. We call it capitalization in French, which doesn't mean so much in English, I guess, but it's a compilation of all lessons learned. You can go through it. It's unfortunate, it's just in French, but we're happy to answer any question you may have on that. There's a question about one toilet for 50 people seem very insufficient. Should it be like one for 20? I know that the standards were longly discussed, and I don't know if Julien or Fiona, you want to answer about the number of sanitations. It is a big challenge today in terms of 1 or 20, 1 or 50. For sure, we would rather to have 1 for 20 people. As Remy said, it was 1 for 2 families was also another goal. We're just trying to go towards the standards that the French government also can respond to. Today is usually 0 for hundreds of people. So in many cases. Julien, I see your mic is no.
Oh yeah, just to say that yeah, it's of course a very important question, and the sphere standard is 20 seats or 20 toilets per user, but it is also accepted in the sphere standard that we may start with 50 because we know that it is very difficult to build enough toilets to reach 20 people per toilet. So it's also accepted to start with 50 and then later on move down to 20. So of course it's not ideal, but
I think it's also important to complete Julien to take into consideration the qualitative aspect, not just the quantitative aspect. Right now, in many sites that we visit, there is just simply a hole in the floor protected by some sticks, wooden sticks. It's suboptimal. It's not satisfactory in terms of hygiene, but people are more likely to request quality, which means like having one toilet adapted to their needs, rather than having several toilets. Once again, these populations, most of the time, they have strong links, sometimes family links, so they don't mind sharing the same toilet. What is at stake here is to find a balance to meet halfway between the needs and what is accepted by the community. If you listen to these communities, they have a lot of needs. If you focus on toilets and you build several toilets, they will tell you we asked only for one, and you'd rather invest your money and your energy in answering all the needs. So it's just striking a balance, yes.
Yes.
Just to complete on that, according to the monitoring process of the United Nations, there is actually in France, in metropolitan France, 877,000 people who do not have access to toilets. So almost 900,000 people without toilets in France.
Just to add something, maybe, yes, the implementation about drinking water connection or sanitation, this is the same thing. The implementation is not actually the real final step, because after that, there is a step of monitoring and maintenance. So normally the Solidarité International should have some examples to give, but yes, just put something in the settlement. Sometimes it's not enough. You have to sensibilize, and you have also to yes, to make some controls. Maybe you have to repair something if something is broken. You have to maintain the toilets, etc., etc. So it's more difficult than just put something and go.
Yeah, it's the difficulties of WASH. I think it's a long-term investment. You can't just install it and leave. So we have a question also on the standards again from Clara Salaveria. How did COVID-19 influence the settlement of a minimum standard of water and sanitation in informal settlement? So I guess the question is, how did it push to get new standards or references numbers, at least in France, which did not exist before? How we came up with putting those standards, and if the standards, at least for water, it's my understanding of the question, also included the need for water for the extra hygiene that was needed because of COVID, because you wash more surfaces, you wash your hands more regularly, you wash the laundry at a higher temperature, but also social distancing or physical distancing at least. So did we change the infrastructure so that the taps would be at a more distance points from each other, for example? So I don't know if anyone wants to respond to that question. Maybe Remy, I know that the infrastructure were adapted, and so maybe you can touch a point on that.
I was not really in the origin of the definition of the standards, so maybe I don't know if I'm well placed to respond. But yes, an adaptation of the global standard have to be done, and we decided to make some technical solution with adapted to the situation, but I don't think it's a fixed solution. It can move. It can be an evolution of this. I don't know.
Just on this question, which is of course very important, it is obvious that the sphere standard, which is 15 liters per person per day, is insufficient for proper hand washing with soap. Because I mean, if you have to wash your hands several times per day in times of COVID, obviously it will be more than 15 liters. So this is why it was increased, I think, mostly.
I would like to add a comment on a side effect of improving wash in informal settlements. When you get water supply, you have to pay the bill at the end, and it was very difficult to negotiate with municipalities any exemption, fee exemption. So at some point, the population in informal settlements prefers to take water at a public water point, rather than having water in the site and having to pay a bill at the end of the month, which is totally fair enough because they have scarce resources. So of course it's problematic when it comes to having a shower, to having proper toilets, but at the end of the month they would avoid many issues with municipality because they don't pay the water they consume.
Thank you, Candice. That's a good point. There are more questions coming. Yeah, so we will share the PowerPoints on directly on the event page in case you're interested and want to share in your countries or with other partners. I am putting the webpage right now in the chat. And I think there is another question. Let me just quickly look into it. I think the number of close to 100 without access to toilet is shockingly high. Is this a priority issue in the media and politics? That would be great. Sandra, what do you think?
Yes, indeed, that would be great. The quick answer is no. As I said, we have been campaigning around the human rights to water and sanitation in France for several years. And I think that thanks to the NGO mobilization, it has been sometimes discussed on the political agenda, including at the National Assembly and the Senate in the Parliament. But it's true that the COVID-19 crisis helped us to show how much this question is important, and I think it helped to raise awareness of the decision makers to pay attention to the issue of access to water and sanitation for all. It's the first time that we can see that some decisions are taken to ask for the municipalities and the prefecture to install access to water and sanitation. So we really would like to take advantage of this work and take advantage of the crisis to really have sustainable solutions. And that's why this opportunity of the European directive that needs to be translated in the French legislation is really good, because right now we don't have a proper recognition of the human right to water and sanitation in French legislation. We don't have any definition of the standards that we're speaking about. So right now in France, there is no official definition of what it means to have a basic access to water and sanitation for the basic needs. And in the European directive, it is not mentioned either, because the European Union really delegate to the member states this implementation of the access to water and sanitation. They ask the member state to define themselves according to the national context. So there is no clear requirements of the minimum standards to member states. It's really there are really many aspects that are left to their appreciations. So that's why we are pushing for having the standards in the transposition of the directive, because then it would be written in French law.
Thank you, Sandra. I think we're nearing 3 p.m. So I thank you for all of you speakers for your answers and for your time. Thank you for the participants for their questions and attention. Please do not hesitate to contact us if you have any question. We'll share more information and the PowerPoints on the webpage. Thank you to the French Water Partnership team for organizing the event as well. And we hope to see you soon and talk more about those questions, and hopefully to hear from your side in your EU countries also, if you have worked on advocacies for the transposition of that directive in your own country. Thank you all.
Thank you, Isa. Thank you, everybody.
Thank you.
Thank you. Goodbye.
Thank you.
Have a good day. Have a good World Water Day.
Thank you. Bye-bye.
Bye-bye.